So I want to call the budget meeting of January 4th, 2021 to order. And this meeting is electronic. It's being held pursuant to Executive Orders number 71 and number 73 from the Governor of Tennessee. As such, all members of the committee must be able to hear me and each other. If you cannot hear other members, please notify me immediately. All votes will be done by roll call. Without objection, the Budget Committee hereby determines that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. This meeting is available to the public on Public Access TV and is streaming live on YouTube. I'll now call the roll. Commissioner Herbert.
Here.
Commissioner Morton.
Morton present.
Commissioner Sturgeon.
Sturgeon here.
Mayor Anderson.
Anderson here.
And Chairman, Commissioner Webb is here. All members of the committee are present. Next up on the agenda is the minutes of the November 2nd, 2020 Budget Committee meeting. Has everyone had a chance to go over those? Some have a motion from Commissioner Herbert. Do I have a second?
Second, Commissioner Morton.
Thank you. All right. Without objection, we're going to do the roll. Those in favor of the minutes, November 2nd, 2020, as presented, signify by saying aye when I call your name. Commissioner Herbert?
Aye.
Commissioner Morton?
Morton, aye.
Commissioner Sturgeon?
Sturgeon, aye.
Mayor Anderson? Mayor Anderson is shaking his head. Yes. And
Anderson, aye.
thank you. Commissioner Webb votes aye to approve the minutes. They are approved. Next up, we have some transfers. Of course, Nina and those who asked for the transfer are here to answer any questions. The first transfer tonight is a request for the available surplus vehicle from the Property Management Department. I'll have a motion for approval.
Herbert, motion to approve.
Thank you. Do I have a second?
Morton, second.
Thank you. Any discussion or questions? We have Kevin and Nina on the line. Ready to vote? Okay. All those in favor of this request for a surplus vehicle, say aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye, passes unanimously. Next up is a transfer request from the General Sessions Court. You see it's $2,000. Do I have a motion for approval?
Herbert, motion to approve.
And do I have a second?
Morton, second.
Thank you. So you want to have any questions? We have Nina on the line, and I thought I saw someone from the court system on the line. Any questions? All right. Seeing none, ready to vote. All those in favor of this transfer from General Sessions Court of $2,000 signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. That transfer passes unanimously. Next item up is Resolution 1-21-1, a resolution transferring up to $2 million general purpose school funds to the Central Cafeteria Fund for the purpose of providing money for a sufficient cash balance in the Central Cafeteria Fund. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. And a second?
Morton, second.
Thank you. I have Mr. Golden, and I have two budget directors from the school system, as well as the county budget director. Would you like to, Mr. Golden, would you like to give a quick explanation of what we're doing here?
Thank you, Mr. Webb. And if I may first, I do want to let you know that Leslie Holman is officially retiring at the end of this week. We have Rachel Farmer, who's currently with our finance department, who's going to be taking Leslie's director job, officially assistant superintendent for finance. Leslie has agreed to stay on officially as a retiree to help us with this year's budget. So I want to make sure you all know that we're going to be making that transition, and Leslie's again graciously agreed to help us through that complex process. In this particular example, the $2 million general purpose school fund, based on what we've gone through with COVID, the income side for the food service department has rendered this need to make this transfer from undesignated fund balance to them. Leslie, I'm probably misusing terms, so correct me. That this is actually in essence a loan that the food service department will have. No, you see, she's shaking her head already. So if you would, Leslie, can you give better terminology?
This is not a loan, or it would have to be repaid by June 30th. We are giving the money, but as I wrote the resolution, the expectation as the food service earns enough money to be able to give us the money back, they will. I checked with the comptroller's office on this, and this is the way we can do it so that it does not have to be repaid by June 30th, which I have no expectation that they could. So it will be repaid when it can, but we will show it as an expense. And when we get the revenue from them, when they do repay us, we'll just show it as income coming in.
All right. Thank you. Does anyone have any questions of Ms. Holman or Mr. Golden?
Herbert has a question.
Go ahead.
My question is, will the CARES Act not pay for any of this? Because aren't y'all required to provide lunches now free to all the students? To what date and when does that end?
Well, those are all some really good questions. So the answer is to that last part, yes, the federal government, the USDA, announced that every school lunch this year will be free. They did that for the first semester, and then they committed to that just a few weeks ago for the second semester. What that means for us is many of our a la carte sales dropped down, and that had a significant impact on our cash flow. Because in our county, we get a significant amount of income immediately from families, and with the USDA, those payments are very much staggered compared to what we're used to. The CARES Act, Leslie may be able to answer some specifics. We did use some of that, some of the federal funding to cover last spring, because we made sure that we maintained our employees at that time. But we don't have that funding for this year to just designate. I will tell you, we have received notice that as of December 27th, the president just signed a new order, and we're just now getting preliminary information in that indicates we may be able to receive some additional money related to some new federal funding. But it's not designated for this. It's what we know at the front end of this is designated for specific instructional issues that may come down the pike that do some offsets.
That's your question, Commissioner?
Yes, thank you.
All right,
One
anyone
more,
else? Anyone
one
else?
more question.
Okay.
The other question is, is this $2 million going to suffice the end of the school year, or are you going to be coming back asking for more?
I think Leslie can best answer that.
I've got the resolution written to be up to 2 million. We are analyzing the cash flow each month. I want to give them as little as possible. And so hopefully the 2 million should suffice to the end of the year. Unless we do a whole new COVID thing and have to start paying the salaries when there's no revenue coming in, even from the USDA, when we have nobody eating.
Okay, thank you.
Anyone else have any questions?
Oh, this is Rogers.
Yes.
Leslie, how much will we have left in our fund balance now if we use the full 2 million?
It will take us down below right now, it's going to take us down below our 3%, which 3% is about 11 million. But we're also coming forward next month with a bus that's another 2 million, and it'll take us down to 9. So we're hit, and I haven't yet made budget amendments for the impact of COVID because I wanted to see where we were and if there was going to be any additional funding that would help us out of the hole. So again, we're right now below with this resolution, but below our 3%.
As a follow-up, Paul, if you allow me to ask Leslie, the emergency money that you're using for that, will that fall within the 3%? the question of you can go below 3%, but it's unexpected expenses. So this is how you're using that.
Yeah.
Thanks.
I want to do a follow-up, Leslie, on that. Can you or Rachel and Jason keep us up to date? We've got a special session coming up this month with the state, and I'm just wondering if they might give some leeway on the 3% fund balance, if we can keep what's happening, keep this committee up to date on what's happening there, because I think that's going to be an impact since the pandemic is still uncertain.
I don't think that that's, the 3% fund balance is, it's recommended. I don't think we're going to fall down to zero. I don't think the special session could do anything about that recommendation. One thing I would like in the special session is that we will probably not get the growth funds that we have always gotten. I've been here 23 years. We've gotten it for 23 years. We will not get it this year unless there is a legislative action, because I've already contacted the Department of Education. Included in this current year's budget is $4 million worth of growth, and we will not get a penny of it because we did not grow. What I would like is some kind of legislation that would say the normal growing counties that exhibit over a 3-year period, that they're always in a growth mode, that they would at least get some of that growth. But that would be my recommendation to you, to go to special session, not the 3%, because that doesn't matter. We can get all the way down to zero and still be in compliance and not have any audit findings on that. But that wouldn't help our 3%. What I want is more money in. I want to get that growth money that we're always used to getting, because we are a growing county. We had a lot of people go over to private and homeschool, and we feel like they'll come back next year and then the year after that. So we'll go back into growth mode. And to miss 1 year of growth money when we've always gotten between $3 and $6 million worth of growth money is harmful to us. So if you want to take something to that special, that's my recommendation.
Thank you. Good comment.
Mr. Chair, to add a little bit
Yes.
to that, what we've heard from the Commissioner of Education is that they expect the discussion of BEP at this special session, and it will include what Leslie was addressing, because most every public school system had a similar experience, especially those who tended to grow. So we ought to, we'll keep you updated with what we hear specifically from the legislature once some items get presented.
All right, thank you. Any other questions on 121-1? Ready to vote? All right, all those in favor signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-1 passes unanimously. Next up is Resolution 121-2, resolution requesting intercategory transfer to place funds in the correct category. This is a $20,000 item. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. And a second?
Morton, second.
Thank you. This is also school. Jason or Leslie, want to discuss this one? I
This
think
is,
it's coming.
Thank you, Mr. Chair. Jason Golden. This is a transfer to the appropriate budget line item within our budget.
All right, just pretty simple there. Any questions? Seeing none, ready to vote? All those in favor of 121-2 signify by saying aye to call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-2 passes unanimously. Next up is 121-4. Is that right, Diane? I think that's right. We skipped 3 as another one. Okay, 121-4, resolution appropriating amending the 2020-21 Election Commission budget by $56,185. Revenues come from state grant funds via the CARES Act. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Morton, second.
Sturgeon, second.
Thank you. I've got Commissioner Morton second that one. Thank you, Commissioner Sturgeon. Does anyone have any questions on that or anyone want to comment? I don't see anyone from the election office on there. It looks pretty simple, but does anyone have any questions?
I have a question,
Go ahead.
Sturgeon. I just like to understand how COVID increased the costs of our election.
All right. The mayor or Nina, I don't see Chad on here. Can you give some insight in Commissioner Sturgeon's question? Either one of you. Nina.
I know as far as personnel, I'm sorry, can you hear me?
Yes.
As far as personnel, it was a challenge for them this year to get workers to come in and work the election office and the polls. There were additional freight expenses and postage because of the mail-in votes, and just additional office supplies that went along with that as well.
All right. Commissioner Sturgeon?
Yep. Thank you, Nina.
Okay. Anyone else have a question? Ready to vote? All those in favor of 121-4 signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-4 passes unanimously. Next up is 121-5, resolution authorizing the Williams County Mayor to enter into an agreement with the State of Tennessee Department of State, Tennessee State Library and Archives, and appropriating and amending the 2020-21 archives budget of $4,993. I have a motion for approval.
Herbert, motion to approve.
Thank you. Do I have a second?
Morton, second.
Thank you. All right, this one looks, again, this is a grant. Does anyone have any questions? Seeing none, ready to vote?
Wait a
Yes.
minute. Oh, Commissioner Webb, this is Commissioner Herbert. What is this grant going to be used for?
I'll have to ask for help here.
Can you hear me, Commissioner?
Yes.
This grant is just for archival supplies, so it's an archives development grant. For us, it'll go specifically just for buying archival boxes and folders.
Okay, that sounds good.
Okay, thank you.
All right. Anyone else have any questions? Ready to vote? All those in favor of 121-5 signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-5 passes unanimously. Next up is 121-6, resolution appropriating and amending the 2020-21 animal control budget by $10,000. Revenues come from donations from Friends of Animal Control. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. And a second?
Morton, second.
Thank you. All right, this is a donation to the animal hospital. Andrea is online. Does anyone have any questions? All right, seeing none, are we ready to vote? All those in favor of 121-6 signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-6 passes unanimously. Next up is Resolution 1-21-7, resolution accepting a donation of $5,000 to be used for maintenance of the Sheriff's Office gun range and appropriating and amending the 2020-2021 Williams County Sheriff's Office budget. Revenues to come from donations. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. And a second?
Morton, second.
All right. Do I have any questions, anyone? I will note this donation coming from the city of Brentwood, just to let you know.
Yeah. Mr. Mayor, the Sheriff, yeah, we
Yes.
get this every year because they use our range and they give us money for that to help maintain the range.
That's good. Any other questions? Thank you, Sheriff. Seeing none, please signify by saying aye. If you're ready to vote, signify by saying aye. If you're in favor of 121-7, Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-7 passes unanimously. Next one up is 121-8, resolution accepting a conditional donation of $1,000 from GFWC Brentwood Franklin Women's Service Club to be used to purchase canine supplies and appropriating and amending the 2020-21 Williams County Sheriff's Office budget by $1,000, revenues to come from donations. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Morton second.
Thank you. Anyone have any questions on this donation? The sheriff's online. Hearing none. All right. Ready to vote on 121-8? All right. All those in favor signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-8 passes unanimously. Next up is Resolution 121-9, resolution correcting the resolution number 1120-11 as approved for grant funding for the Williams County Library and appropriating and amending the 2020-2021 library budget by $2,284. Do I have a motion for approval?
Herbert, motion to approve.
Do I have a second?
Morton second.
Thank you. All right, this is a grant, just we're correcting the numbers on this one. It is requires a match from us. Does anyone else have any questions? So I have the library director is on the call. All right, seeing none, ready to vote on 121-9. All those in favor signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-9 passes unanimously. Next up is 121-10, a resolution appropriating and amending the 2020-2021 county general budget by $78,330.84. Revenues come from victim assessment fees. Do I have a motion to approve?
Herbert, motion to approve.
Thank you. Is there a second?
Sturgeon, second.
Thank you, Commissioner Sturgeon. All right. Does anyone have any questions?
Yeah, I have a question.
Okay.
I'd like to know how many people are actually helped by this fund. You know, is it 1 or 2 a year, or is it 20, or how many victims do we have that receive these funds?
All right. Let's see if we have someone. I don't have the call-in number. Someone answer this for Commissioner Sturgeon.
Mr. Chairman, this is Rogers. I don't know that I can get you that answer right now,
Yeah.
Sturgeon, but we can get somebody to reach out to you. It'll probably be tomorrow, the next day.
That'd be fine. Thank you.
Diane, would you ask one of them to reach out to Commissioner Sturgeon with her question answered?
Yes, sir. The request came from District Attorney Kim Helper to release the funds, so I'll shoot her an email.
All right.
Commissioner Webb, this is Commissioner
ma'am.
Herbert. I have a question also.
Yes.
I just would like to hear more clarification. Is this money just given directly to the victims? Is it spent on education programs for them? I mean, exactly how do they spend this?
I think from the conversation on Commissioner Sturgeon's question, there's no one on the call, so we can't answer that. Would you like to defer this one or pass it without a vote? What would you like to do since we don't have an answer for those questions?
I don't mind going on and voting on it, but I would like some answers to the question. If you could have Attorney General Helper contact us more, me and Commissioner Sturgeon, more about this, you know, what the funds are, how many victims and what the funds are actually used for. I'd appreciate it. Thank you.
Commissioner,
Thank you, Commissioner.
Could I make a comment?
Just say we're talking over each other. Let's have Diane first, and then Commissioner Sturgeon. Diane, go ahead.
I was just gonna let Commissioner Herbert know that I would include that in my email request, and I'll send it out to everyone on the call.
Thank you. Commissioner Sturgeon?
Thank you.
Yeah, I do know of a person who was a victim of violent crime in Davidson County, and They went to Vanderbilt basically and made an application. Vanderbilt said, we'll keep treating you if you make an application to victims of violent crime. This person had been shot like 6 times. And they received $30,000, but the money never went to the victim. It went directly to pay the medical bills at Vanderbilt. So that's just one example. I don't know other ways, but that's one way that they get used. So
Okay.
just wanted to add that.
Those are good questions. Hopefully get some answers. All right.
Thank
Any other questions on 12110? Since the committee wants to go ahead and vote on it, then we'll get those questions and we can discuss it again if necessary at the commission meeting next Monday night. Any other questions right now? All right. All those in favor of 12110, signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. Resolution 12110 passes unanimously. Next up is Resolution 12111, resolution appropriating and amending the 2020-21 property management budget by $36,213.26 for costs associated with the approval of 2 additional property management positions. Revenues come from unappropriated county general fund balance. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Sturgeon, second.
Thank you. There is an amendment. I'm going to ask the mayor to address the amendment or Mr. Weber, whichever one can explain it the best, because we will make sure we get the amendment discussed from the human resources before we vote. So who knows what the amendment really does? We'll speak to that before we address the amendment.
Well, Paul, this is Rogers. The amendment was made in the HR committee to provide health insurance to the current part-time employees. But before you do the amendment, let me explain what this is for. In Kevin's department, Kevin Benson's department, as because of COVID, we've had to hire additional personnel, particularly to deal with the security entrance of our facilities here at the administrative complex, both at Mrs. Anderson's office up front and over on the western side of the wing going in here. As all of you know, we have put in strict requirements coming in from temperature readings to asking the questions of people coming in and out. And over the last 30 days, we have restricted the people coming in by allowing them to pay their property taxes in a drop box out front, et cetera, et cetera. So when Kevin approached me with it, we have hired under his out of his part-time money, 2 watchmen. And those 2 watchmen are working extremely long hours. If they work over 30 hours, then they're required to have health insurance. Now, the health insurance side has to be provided for them. And so in our thinking, which none of us like to do, is hire new people in mid-year, but because of the COVID, we're forced with either leaving these people on part-time or putting them on full-time. My suggestion is we put them on full-time because I don't think COVID's going to go away for the next foreseeable future, or certainly not between now and the first part of the next fiscal year. And number 2 is some of these people are working 20 and 30 extra hours per week just to maintain our staff here. We've got several elderly people that work in the evening hours. They've had COVID, and these 2 and 3 part-time people we have, they're working 50 and 60 hours a week. Now that doesn't give them any benefits, doesn't give them any vacation, doesn't give them any of that time off. And so my suggestion is we allow these 2 people to come on as full-time people here at during this period of time. And now the Human Resources Committee felt like only to not allow them to come on full-time at mid-year. I was not on that phone call to plead the case, but I don't think that's the way we should be treating our employees. when they're working that many hours for us, and that we're wearing these two people out particularly. So that's the statement on it, Paul. As far as the amendment that was offered, the amendment that HR brought forward was just to provide health insurance and not all the other benefits.
All right. Before we go, I've got, we have numerous people that are calling in on the telephone that are not muted, and so it makes it hard to hear those that are speaking. So if you're on the phone, please push *6 or mute your telephone so that we won't have the feedback and interruption. Thank you. And that's concern is reading this over again, Mr. Mayor. I wasn't sure if this was, we were going to hire these employees with a benefit package shown in the resolution, and then the amendment was to go to 2 other employees that are already employed and pay the health insurance. That was the confusion on my end. And if we were going to do that, it seems like there would have to be a dollar figure for us to approve before we could act on it. Nina, are you going to comment on that?
Mr. Chairman, can you hear me?
Yes.
Mike.
Yes.
Essentially, what we're doing is taking these 2 part-time positions, turning them into full-time positions.
Okay.
Both these gentlemen were part-time employees when they joined us back in February. Then late summer, when all the different executive orders and everything came out, Kevin asked if we could have, if among his security people, if anybody be interested in going to the 40-hour week because of temperatures and everything else during the day. These 2 did step up. They've been working those hours since late summer. And so it was just a question of, since under the Affordable Care Act, we are required to provide them medical insurance, albeit for the year measurement period. That they would be going, if we waited till July to act, these people would be going 10 months with no vacation, no sick time. Even one of them stopped me saying he was happy he did get a holiday off. Of course, he didn't get paid, for it, and nothing else. And with Kevin's, and Kevin can speak to it as need be, he does feel there will be need for these people even after COVID, because they were still filling in spots, and they're still, I had to say something the other day about a good amount of overtime that's being spent, in that department, asking about to make sure that we weren't missing something. It's just because, the nature of the beast, 24/7, they were here Christmas, they were here New Year's. He's got a lot of opening and a lot of opportunity. So that's why we, suggested going ahead. The only benefits they will get above the medical by doing it this way will be vacation, will be holiday pay. They'll allow them to be TCRS, participate in that. That will be the only additional cost to what, if we go with the amendment and just provide the medical. Well, if you look, you already see the FICA and the Social Security, that's coming anyway. The only thing that would be added if we went this route would be the 4.85% of their hourly salary, $14 an hour, through the remainder of the fiscal year, and then, what we do next year.
All right. Thank you. Anyone have any questions?
This is Herbert. I have a question.
Go ahead.
I know they're used now to check temperatures and things like that. So what about when we're through with this COVID, hopefully 6 or a year, whatever? What's those positions? Are you going to keep those positions? You're going to lay them off?
This is Kevin. I can speak to that, Commissioner.
Go ahead, Kevin.
Yes, again, the facility AOC is open 24/7, weekends, holidays, evenings. They would just transition and stay in place. So we continue to use them in the AOC. There is a need, a severe need for security here, even without COVID, with active shooters, so on and so forth. Until we had the building locked down, the only way we can really control it is with personnel. And those 2 full-time personnel would assist us in maintaining that security for the protection of both our employees and for the taxpayers that come in and use the facility as well.
Mr. Herbert?
Is that in addition to a deputy from the sheriff's department? I know the ones there that we approved that last year for, due to angry customers and things.
Yes, ma'am. And that position, I do not hold that sheriff deputy into any one position. He roams, he goes from office to office, door to door. He's not locked into one location. So he's able to react anywhere in the facility and even in the parking lot as needed, wherever there's a problem. And then we still maintain positive control of all entryways throughout the building. Again, he or she is never going to be assigned a particular position. They're roamers.
Okay, so you're stating that these two positions will continue to be full-time from now on out, even when COVID's gone, that you feel like there is a need for that?
Yes, ma'am. I feel there definitely is a need.
Okay, thank you.
Okay, any other questions?
I think, Paul, if I could address it a little broader to Commissioner Herbert, is that during the early parts of this COVID, we were using the sheriff's personnel. And then as they're needed more out at the Ag Center and other places throughout the county, we had to fill with something. They're also posting these individuals not only at the west wing and the central side, but where they come into the get your car tags now, which is on the county commission side of the building. So you've got three major entry points into our building. All the other doors are locked down. And so that's providing security not only for county general, but it's providing for the school personnel that come and go, the clerk's office, property assessor, everyone here. It just happens to fall within Kevin's budget.
All right, any other questions? I'm going to come back to Mr. Weber to make sure this is clear to me, is on the amendment, all the amendment is going to do is save us $606.67 because we still have to pay the Social Security and the Medicare and probably life insurance is included with medical care. Am I right, Mike? If the amendment were to pass? You're muted, Mike.
I'm sorry, my TV wasn't, my monitor wasn't working. I'm on the phone.
Okay.
No, I don't think the life insurance, and I might misspoke on the life insurance. I just did a quick view. But the FICA, the Social Security, that comes out anyhow. The medical benefits now will come out. And then we're talking about the Tennessee Consolidated Retirement will come out if they are made full-time, or at the point they're made full-time. If they remain part-time, then that will not come out. And probably then the life insurance would not come out either. But all the rest of it would still be there. They still have to have medical and the FICA and the Social Security.
All right, so that's the part I'm trying. If this amendment were to pass, it would save us under $630 over the next few months until June 30th. Is that?
I would have to look at 4.5 or 4.85% for TCRS, and then whatever few dollars that life insurance is. So
Right.
I'd have to multiply that out by the 14.
Yeah, that's what I'm looking on the resolution. So, okay, if the amendment, if the amendment passes per HR, the way I understand this, we would not pay retirement and the life insurance. If the amendment fails, we would pay the $36,213.26 as presented. That sound right? All the views they've looked at it?
Yes, sir. I'm having to get my
Okay.
passes and fails in right order.
Okay. All right. I want to make clear. Does the Budget Committee understand that? All right. Because then I think we want to look at the amendment now. And Jeff, I look to you because this one didn't have enough detail for me. So now the amendment as provided by the HR Committee, we'll vote on that before we vote on the full resolution, Jeff?
If you get a motion and a second for the amendment, otherwise it would be just the main motion.
All right, thank you. All right, Budget Committee, is there a motion for the amendment as presented by the HR Committee?
Commissioner Webb, I have a question. Why, I might have missed something. Why would we not pay for the retirement and life insurance if they're going to be full-time employees?
This amendment
Something-
says that we wouldn't, the amendment says that we would not pay it. That's what the amendment essentially is saying.
But why would we treat them different than anyone else?
Judy, that's the point. HR was only wanting to pay for the health insurance for these people, not put them on as full-time. And they put the amendment on, and as Jeff Mosley just said, if you don't get a motion for that, then you're looking at the resolution as its entirety, and that these two people would come on and be full-time. That's the recommendation that I'm making here, and treat them like anyone else so they can get paid for holiday and some sick time, because we're working our people to death over here. We need to treat them right.
Any other questions? What I'm seeing is I do not have a motion for the amendment, so we'll go back to resolution 2111 with
Motion to amend. Commissioner Herbert, motion to amend.
Motion to amend. Okay, thank you, Commissioner Herbert. Do we have a second on the amendment?
Just for clarification, is Commissioner Herbert's amendment identical to the HR committee, or is it different?
Commissioner Herbert?
And theirs is to provide the life insurance and the retirement, correct? Like every other employee?
No,
No.
no, ma'am.
I'm
They can-
totally confused.
The motion through the HR committee, if I may, Mr. Chairman, just to
Go
add
ahead.
clarification. The motion through the HR committee was that according to, I believe it is Obamacare, is that not correct, Mike Weber? That part-time employees can be offered medical health benefits as part-time, that they did not have to be full-time employees to get health insurance. So that was their motion, was to keep them as part-time employees and give them health insurance as part-time employees.
And their motion was not to treat them as full-time and only give them the health care insurance. So if you wanted the amendment, it would continue to treat them as part-time, only provide the health insurance, and would not give them the other benefits. Without the amendment, you have the resolution in front of you, which would be all of the benefits and a full-time designation.
Commissioner Herbert, does that help you?
Clear as mud.
Well, my husband came in making noise, so I missed a little bit of it. So I assume with this amendment, is it's amended, they're treated like every other employee.
Just the opposite. Just the opposite.
The opposite. So if I do the amendment, they're treated like every other employee, right?
If the amendment fails, they're treated like full-time employees with holidays, vacation, sick, what you'll see there, the numbers, plus the other benefits of a full-time employee.
Okay, I'll remove my motion to approve.
Original resolution as presented would do that.
Right.
Okay, I withdraw my motion to approve.
Thank you. Commissioner Sturgeon, does that help you?
You're muted.
Yeah, I just lost audio for about 2 minutes. So, but what I understand is that the amendment takes away any retirement benefits. So if we don't have the amendment, then they're full-time employees with full benefits, just like everybody else.
Exactly. That's right.
All right. So before I lose audio again, I say no on the amendment and yes on the resolution.
Okay. So the amendment did not have a motion. And so we're back to the resolution 12111 as presented. So are we ready to vote now? All right, here we go. All those in favor of 121-11 signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon. We've lost your audio, Commissioner Sturgeon.
Sturgeon, aye.
There we go. Thank you, Commissioner Sturgeon. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. Resolution 12111 passes unanimously. Next up is Resolution 121-12. Resolution appropriating amending the 2020-21 budget for $26,864.01 for costs associated with the approval of one additional registered nurse position. Revenues come from the unappropriated county general fund balance. Do I have a motion for approval?
Herbert, motion to approve.
Do I have a second?
Morton, second.
Thank you. We have Kathy Montgomery on the line. You can see this is adding a position out of the county general fund balance. Do you have questions? Are you ready to vote?
Mr. Chairman.
Yes.
Go ahead and do your vote, but before you move away and Kathy leaves, if you don't mind, let her give a synopsis to everyone on here about what is happening with our vaccines, because many of you are getting questions after the vote, if you don't mind.
Okay, let's vote first, then we'll come back and recognize Kathy Montgomery. Okay, anyone have any questions on 12112? All right, ready to vote? All those in favor of 12112, by saying aye when I call your name. Commissioner Herbert?
Herbert, aye.
Thank you. Commissioner Morton?
Morton, aye.
Thank you. Commissioner Sturgeon?
Sturgeon, aye.
Thank you. Mayor Anderson?
Anderson, aye.
Thank you. Commissioner Webb votes aye. 12112 passes unanimously. Now, without objection, Kathy, can you do what the mayor asked, just kind of give us a vaccine update?
Absolutely. Thanks so much. I will say that the local health departments have been receiving both Moderna and Pfizer vaccine. On Saturday, let me just kind of update you there. We've already been vaccinating the 1A1, which are the first responder population, and 1A2 populations, which are healthcare workers. And effective on Saturday, we were starting to vaccinate those populations that were 75 and over. On Saturday, I can tell you that we vaccinated 780 people through the Ag Center, which was absolutely incredible for our team. Really give them some huge kudos. Right now, with the 75 and older population, there hasn't been a whole lot of information that's been sent out to them, but we've been really trying to be strategic. We're definitely working with EMA and other agencies, but we've been trying to be strategic about scheduling so that we have enough vaccine. We don't want to schedule past appointment slots if we don't have vaccine available, and then also trying to be a little strategic about when we're going to be giving those second doses for both Pfizer and Moderna. It's made it a little complex for us for a couple of reasons, because Pfizer, we have to revaccinate for second doses within 21 days, and for Moderna, it's within 28 days. It's also really important that we schedule appointment slots because of the movement of vaccine. You have to move it from freezer to refrigerator. It only has a shelf life in the refrigerator so many days or so many weeks. And then once you bring it out of the cooler, it has to sit at room temperature based on what type you're looking at for anywhere from 15 to 30 minutes. Pfizer has to be diluted. So you understand there's a whole lot of complexities that are involved with just the vaccine itself. And we're really trying our darndest not to waste any vaccine. So why we're working really, really closely with EMA, and huge kudos to them for managing our first dose vaccinations. We're going to be looking at second dose vaccinations starting the week of January the 18th. So that really gives us limits on how many first doses that we can give, because we're trying to get those second doses in. So it's continuous. And in addition, we're also continuing to test individuals with Everly Wells kits on Monday, Wednesday, Friday, and then doing the PCR tests on Tuesdays and Thursdays. So it's been a lot. So this position, I appreciate the vote, because our RN position, with being the fastest growing county and in the state, we're still continuing primary care services here at the health department, and all of our nurse triage, med refills, communicable disease. So it's been a lot for us right now, but we're making it. It's 2021.
Thank you, Kathy. All right. I'm not sure we got time for questions right now, but can they email you or leave you a voice message? Yes, okay. So if you have any individual questions, please feel free to email Kathy or call her. You probably have to leave her a message on the phone if you call her, though.
And you may be able to, Mr. Chairman, reference a statement from the health department that I forwarded out to all of you earlier this evening. It may have some questions answered without needing to call Kathy first.
Right.
Yeah, thanks, Diane. And just real quickly, if I may, Commissioner, yes, that email that Diane sent out, it actually has links to the vaccine, how they can register for a vaccine. We're continuously updating that based on vaccine availability. So definitely look at that information that Diane sent out because it's got a ton of information.
All right. Thank you, Kathy. All right. Ready to move along? Next up. Okay, committee. Resolution 1-21-14, resolution to authorize the establishment and assessment of fees collected by the Williamson County Animal Center. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Sturgeon, second.
Commissioner Sturgeon, second. Thank you. Does anyone have any questions? Andrea's online. It's a lot of information. I've looked at it. It looks reasonable. Anyone have any questions? Seeing none, we ready to vote? Gonna let Andrea off easy. Barbara, you got a question?
I have a question. Sorry,
Okay.
I messed up the mute. I was just curious how much of a change this is from previously.
There are only a couple of fees that will change. One being cost of public euthanasia. So we're going from $25 to $50. We're also establishing a fee for cremation because a lot of families that come through and have their animals euthanized here will ask for cremation services, and we don't have a to charge them for that, but we do get charged for it. So they right now having to pass that through via credit card to the cremation company. So this will just make it a little bit easier. And then the establishment of a fee schedule for the spay neuter clinic. So all of those fees are new. We have been doing public spay neuter, but only for animals that qualify under the income qualifications set forth by the state. And this will establish a fee schedule where there will be basically a low-cost option for anyone who wants to utilize that service.
Hey, Andrea, I don't see cremation or euthanasia on the resolution. Am I missing it?
I don't have the resolution in front of me, but I have the information that I sent over, and cremation and euthanasia were both on that list.
Oh, wait. I do see it. I do. I'm sorry. It's underneath the microchipping. And the bite. Yeah. Okay. Thank you very much.
All right. Anyone else have any other questions? Ready to vote on 121-14? All right. If you're in favor of 121-14, signify by saying aye when I call your name. Commissioner Herbert?
Herbert, aye, as all my dogs are running around barking now.
Thank you. Commissioner Morton?
Woof.
Woof. Should I take that as an aye? Commissioner?
As an aye.
Sturgeon, aye.
Thank you. Mayor Anderson?
Knowing Judy, those dogs don't have to worry about it. It's her husband barking, but I vote aye.
Thank you. Commissioner Webb votes aye. 121-14 passes unanimously. Next up is 121-16. A resolution amending the 5-year capital improvement program for schools, roads, fire protection, and recreation. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Morton, second.
Sturgeon, second.
I've got Commissioner Morton second on that one. And Nina's on the line if you have any questions on this one. This is routine. We do it every year. Of course, we'll look at this again during the spring's budget meetings. Does anyone have any questions?
Yeah, Paul, I have a question.
Yes, go ahead.
Yeah, I'm just curious what major changes were made between this year and last year?
Nina, you want to answer that one?
I would just have to go back and look at the listing from the previous year. But as you know, our capital improvement requests change from year to year. This particular resolution is to allow us to collect the privilege taxes. You're not really approving any of the individual projects. It's just submitting a plan so that we can collect the privilege taxes.
Okay. Well, on the email, the attachments are really hard to read. I just would want to point that out. Where they're highlighted, it's so dark you can't read the numbers, at least on mine. So I don't know.
We will get to look at these again, but that's a good point, Commissioner Sturgeon, that sometimes the copies are hard to read, so we can work on that. Any other questions? All right, are we ready to vote? All those in favor of 121-16 signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 121-16 passes unanimously. Next one up, and this will be the last one that we vote on tonight, is Resolution 1-2117. Resolution accepting roads in Falls Grove subdivision, Section 1, located off I know a lady named Udaly, so Udaly Covington Road, part of the county road system for maintenance by the county highway department. Do I have a motion for approval?
Herbert, motion to approve.
Thank you. Do I have a second?
Morton, second.
Thank you. All right. This is from the highway department. Does anyone have any questions? I believe the mayor can answer those. He sits on the highway board, highway commission.
We reviewed these this morning. It came to the highway department last month. Now it's been put in the form of a resolution to accept those roads into our system after y'all vote on it.
Any questions? Ready to vote on 1-2117? All right. If you're in favor of 1-21-17, please signify by saying aye when I call your name. Commissioner Herbert.
Herbert, aye.
Thank you. Commissioner Morton.
Morton, aye.
Thank you. Commissioner Sturgeon.
Sturgeon, aye.
Thank you. Mayor Anderson.
Anderson, aye.
Thank you. Commissioner Webb votes aye. 1-21-17 passes unanimously. Next up on the agenda is any updates from Mayor Anderson to the Budget Committee.
Hey, Paul, what happened to Resolution 18?
That does need Budget Committee action. That was just in the packet for your information.
Thank you.
I'm glad you brought that up, Commissioner, because I'm going to let Jeff talk about it before we get off from here. Because this doesn't have a dollar value to us, let him explain the resolution 12118 in regard to the certificate of need requirement and the laws that are going on. Jeff?
Yeah, the certificate of need is a process for allocation of resources in the state. There's the Tennessee Health Services and Development Agency, which implements a certificate of need. And basically, you just have to show there's a need for certain facilities or facilities over a certain dollar amount in a particular community. And the idea is to avoid duplication or overutilization within an area, which could harm the provision of services in a particular community. That authorization for the Health Services and Development Agency sunsets next year. So it would go away, and if it goes away, the certificate of need will go away. Also, in the last session of the legislature, there was a bill which would have lowered the population limit for outpatient diagnostic centers, and there was an amendment to that which would have allowed ASCs in counties where in excess of the population of 175,000 would have caught Williamson County. And so anyone could build an ASC or an outpatient diagnostic center without a certificate of need. Well, the problem with that is that outpatient services are by and large the profitable services in the healthcare facility, and those providers would not be required to provide other services that the hospital has to provide by federal law and by state law. And so therefore, the idea that the hospital, and Matt Williams as the sponsor is proposing, is letting our representatives know that we do not support either the amendment that would minimize or decrease the population exception for outpatient services, or allowing the CON to sunset, as this would be detrimental to Williamson Medical Center and the services that they provide in the community. So that is the 30,000-foot view of it. And it actually would affect other counties as well. I'm not sure how much you care about that, but you could see where if they could go build ASCs or ODCs in Spring Hill on the Williamson County side without a CON, that would affect Murray County as well. If they could build them just inside the line on Rutherford or Hickman or Cheatham County lines, it could affect those counties as well, because it would take the profitable aspects from their community hospitals and funnel those to these outpatient services, which do not have the same obligations for community care, or indigent care as well. So that's the underlying premise, is that there at least ought to be some oversight to avoid overbuilding of resources that undermine the financial capabilities of all providers.
Mr. Mayor. You're still muted, Rogers.
I'm sorry.
There we go.
Let me tip my hat off. I appreciate Jeff giving that 30,000-foot overview on the CON, but also say thanks to so many people over the last several months, but particularly into Todd Horton, Hannah Bleem, Kathy Montgomery, and her entire staff. The testing, the vaccines, as you all are getting phone calls, that's why we asked Diane to send that out to all of you, so you know when your constituents, your people in your community call and say, hey, I'm over 75, I want a shot for myself, or I want it for my mom and dad. These are the procedures we're going through. I mean, the people are working around the clock trying to get all this handled. It is a monumental task. And quite frankly, we just don't have all the vaccines. You're going to hear some counties that are telling people just to drive out and get in line and get your shot. Our preferred method is by appointment only, so that people are not waiting in line 3 and 4 hours. The vaccine runs out and the people beyond that certain point no longer get a shot. They're very irritated in Knoxville and Hamilton County and in Wilson County. We're going to preferred method of call in, get reserved. We're trying to get the message out to our senior population, particularly the 75 and older. So you're going to see a real blitz on the local radio stations, but we're still limited by the number of vaccines and by the people that can give them out. So when you see those affected different areas, emergency management, public safety, public health, I really encourage you to give them a pat on the back, because they're all tired or worn out. Our numbers at the hospital are exceedingly growing every day. I should caution all of you to please take the precautionary care that you can, that you don't wind up over in our hospital. We're over, what was the number, Jeff? We had the conference call, was it 40 something?
The inpatient census for COVID was 55 today, which is the highest number we've ever had. It is continuing to grow, and they don't know that they've seen the peak from the Thanksgiving holiday season and Christmas holiday season yet.
So, and finally, Mr. Chairman, I know that you are having to deal with COVID in your family, not you personally, and my prayers go out to you and your immediate family. It's affecting all of us. So please take those precautionary measures and whatever you can. Paula, my prayers are with you and your family.
Thank you, Mayor. The following call also, they said that the ER was crowded, and if you're like me, you got the chainsaw out. I would like to get in there when I cut my finger off. So let's be considerate. It sounds funny, but I have done that, almost cut my finger off. So it's a serious time. So, Mr. Mayor, thank you. With you, all those first responders, they are our heroes. Those that warn people to get out of the way of that bomb in Nashville are right at the top of that list of our heroes that sometimes are unappreciated. So with that, does anyone have any other business for the Budget Committee? If not, Herbert, would you, I'll entertain a motion for dismissal.
Herbert, motion to adjourn.
Thank you, Commissioner Morton. He seconds that. And with no other business, we are adjourned. Thank you very much, everyone. Please be safe and a happy New Year.